Today on Fluorosis Files with Mama Maji, we are at Lake Basin Dental and Orthodontic Center. Prevention is better than cure, but how does it look like in the context of dental fluorosis? Come with me as I engage Dr. Kennedy Carson Opiyo as he shares his personal experience as a patient who suffered dental fluorosis.
Okay, I'm Dr. Kennedy Carson Opiyo, a dentist, an orthodontist, and soon to be a member of Royal College of Surgeons, Edinburgh and Royal College of Surgeons, England. Okay, dental fluorosis is a menace in this country and especially now in Nairobi County because I think we are sinking boreholes without a plan. Yeah, we are not doing the surveying plan to see whether the water is the level of content of fluoride in the water, the boreholes that we are sinking. So management of fluorosis is a bit expensive, yeah, because fluorosis would lead to so many things. As we know, a tooth that is fluorosed, that means the high level of fluoride in the tooth leads to the tooth breaking down. So this can lead to so many things. One, of course, the major one is that the teeth will be brown, and therefore the child or the adult or the patient will be having low self-esteem because people will be teasing you. The other thing is that when the teeth break down, of course, the nerve will be exposed and the tooth will need a root canal or removal, replacement with implant, replacement with a bridge, yeah, and of course function, yeah. So if your teeth are broken down, the chewability is now reduced, and so the prevention is better than cure, because now if the teeth have already been affected by fluorosis, depending on the amount of exposure, depending on how long the exposure was, and of course how old the patient was when they were first exposed to the fluoride, the degree of presentation will be different. Yeah, so some will come with minor streak of white on the teeth, but others come with teeth that are so dark brown that they have been broken down that there's nothing you can do. You just have to remove them. And the cost in terms of psychological torture, the trauma, and the cost in terms of finances. So it's just so huge that everything should be taken, we should take care of the teeth before they get the fluorosis. So everything should be done to make sure that we are not exposing the teeth to excess fluoride. Yeah. Growing up as a child, we used to use a borehole. Yeah. Like innocently in the village, there are no water points. We don't have the piped water. So what would happen is that able members of the society, the village, they will sink boreholes and sell to the villagers. So we would just go draw water, and that is what we were using for cooking. And yeah, so I was still young. As we know, fluorosis affects people mostly when they are still less than 8 years. So I was young. I was born there. So my teeth were seriously affected, and this was a very big problem for me when I was in primary school, because kids would segregate you. Yeah, they will laugh at you because they also don't know that this is a problem. It is a medical condition. They think you've smeared something on your teeth. They see you different. When I went to the high school, it was the same story. Yeah, people would, you want to discuss with them because fluorosis also, it makes you become isolated in the sense that you feel like you are not brushing your teeth enough because you don't have full information about fluorosis. Yeah, so it makes you to be so keen about your oral hygiene that you end up brushing excessively and exposing your teeth as you do that. So I suffered a lot of sensitivity when I was now in campus. Yeah, and I couldn't wait to be a dentist to correct this myself. Yeah. So when I got an opportunity now practicing as a dentist, I did digital crowns to cover them because mine was even pitted. They were so sensitive. At one point, I could not even brush. Yeah. So it would force me now to use mouthwash instead of brushing to keep my mouth fresh and my teeth clean. The average cost in the market, well, it depends on the procedure that is being done because, as I've said, we have various modes of treatment for fluorosis. Yeah, for mild fluorosis, we can do bleaching, which probably range between 15 to 40,000. We can do resin infiltration so that we can make the tooth surface to look uniform. That would cost something like 10,000 per tooth. Or we can do masking for the teeth that now seriously affected but the patient is not having enough money to be able to do a permanent solution for it. So masking is also ranged between 6,000 to 10,000. I mean, this again is affected by the material that is used. The practitioners who charge maybe 4,000, but now maybe the quality of the material that they are using would not last. Maybe after, maybe 1 week or 1 month, they are discolored again or they are fractured. So that depends on what type of composite you are using, yeah? Okay, then we have the veneers, which is the permanent option of masking, yeah? Veneers, it depends. Some practitioners charge 30,000, some charge as high as 70,000, especially the ones that have to send their work abroad, per tooth, their work abroad. And of course now the ultimate is crowns, when a tooth that is now being salvaged, a tooth that is now broken both from the outside and the inside, and probably it's exposed, we have to do root canals first. Then in that case now we will have to do crowns, yeah? Because again, there is what is now coming as a new trend, where the dentists abroad are doing in Turkey and everywhere, called a smile makeover, whereby we know fluorosis affects the bondability of the tooth. Your teeth need braces, but you have fluorosis. So it becomes a problem with retention of the bracket, retention of the aligners. You put attachment, they just come off. So in such case, the patient has to go one go, whereby now they are going to do crowns, not just to correct the discoloration, but in this case now they are doing crowns to correct both the discoloration and the misalignment, because now it's a bit expensive, because in this case you will have to do majority of the teeth, and thinking of it at 35,000, let's say per tooth, for let's say 20 smiling zone, 20 teeth in the smiling zone is not small money. Yeah, so majority of Kenyans do masking, yeah, because it is cost friendly. I think message to a young parent is that, first of all, before you go to that fancy estate, make sure that they have a policy that the water that they are getting from the borehole, it has been investigated, the fluoride content has been established, and they are doing measures. They have installed machines that are going to defluoride the water, and it will be fluoride free, so that you prevent it, because the cost of restoring the damage done by fluorosis is just too high. So personally, I've installed the machine from the Mama Maji, so now I'm able to defluoride my water both in the clinic and at home. And we no longer buy water, yeah, the bottled water. So we just we get water from the tap. The machine is able to make it fluoride free, and not just that, it is introducing some ions that are very important in your body. So instead of just buying a distilled water that may not have these other important ions in your body, this one is able to introduce some ions in that water, and then it is not just defluoridated, it is also introducing these ions, which are very helpful in your body. Together for a fluorosis-free future.